Hi, I'm Mayur Shetty, CEO of Blackfrog Technologies. Thank you for having me here today. Thank you for making it despite the lashing rains, and it's a very cozy Saturday that we would have rather spent at home being cozy in bed. So thank you. I would do my best to do justice to this. I think the past 6 years now, whenever I get an opportunity to stand in front of a mic, I just start with vaccines, kharab ho raha hai, vaccines, kharab ho raha hai. I'm going to take Mr. Rohit Bhatt's advice on it's your story. So I will quickly run through my journey from college to entrepreneurship and what has been the journey of Blackfrog. Some of the serendipitous events, how one thing has led to another, and finally led to the development of a product and the social impact that we're trying to create. I grew up in Manipal. I'm originally from Manipal. As a child, I really looked up to my grandfather, who was an Indian Air Force veteran. He moved back after retirement to Manipal to set up a small bus coach building plant. You get the chassis from Ashok Leyland and Tata, and the coach building plant, they build the rest of the bus. So I spent most of my childhood in the factory with him, and I think a large part of my childhood and my inquisitiveness was developed around. So as a kid, as a young boy, I'm sure a lot of you can relate to this. If you travel by city bus or the express bus, you prefer sitting next to the driver, the seat adjacent to the driver, because that's the most fun, right? And when you sit in that seat, you see the driver with the older buses having the long levers for the gear knob, and you see him moving that so violently, and you wonder what goes on underneath that. And I think that led to my curiosity of what is that magic that goes on underneath this box that translates it into motion and keeps it going. And that's what I wanted to learn, and that led to me joining automobile engineering in MIT. I was very keen, and I think that single focus on understanding how vehicles work is probably a good thing for the curriculum and engineering, but it's also got a dark side to it, because by the end of third year, I kind of clearly understood what happens in a car or a bus. So then what, right? I have clearly understood this. Now there is, how do I make a living out of this? And then I spoke to one of my older batchmates from school who works at Center for Policy Research. He was working in policy advocacy in renewable energy. And I asked him about the kind of line of work you do as an automobile engineer and things like that. He kind of jokingly said, dude, life has played a scam on you. The entire world is moving towards renewable energy and electric cars right now, and you spent the last years training on how petrol is burnt and a car runs on diesel. This is so obsolete right now. Which is not. I mean, it's funny. It's not really true, but that kind of got me thinking, and I think a large part of my childhood I spent kind of hating this place. I really disliked everything about Udupi and Mangalore. I felt very suffocated. I thought this is not the right place for me to grow, and I had a little bit of intense dislike for the place. This changed in about second or third year of college, when I had to travel to Delhi for a conference, and I had to borrow a particular amount of money for the travel. So I booked only one way ticket, and I booked a ticket and I went, and I spent the conference. It took a little longer than it was supposed to, and at the end of by the end of the week, I kind of lost all of the money. Lost as in not lost the money, but I spent all of the money, and I had no way of coming back. And it's kind of not very nice to ask your parents for money again and again, right? So while going, I went by flight, and then while coming back, I didn't have money even for a train ticket. So I thought, what do I do now? This is very awkward. So I decided on taking a series of buses. I thought, so I found that there is a bus going from Delhi to Gurgaon, Gurgaon to Jaipur, Jaipur to Udaipur to Jaipur, Jaipur to Mumbai, Mumbai to Goa, Goa to Manipal. I thought, why not? This sounds like fun. I've always been in Manipal. This is a great way for me to learn about my country, kind of get to know everybody on the way, see people, see my country up close and understand things. When I came back and I reached Manipal, it took me about 9 days. The second I reached back at Manipal, I'm like, I'm never getting out of Manipal. I'm always living here. This is the best place. Udupi is a temple. I don't mean Udupi temple. Udupi is a temple where the air is so clean, the water is clean, people are nice. In Delhi, I'm so worried that somebody honks at traffic, somebody will pull a talwar out, and I don't want that grief. I want to have that comfort where I will honk at somebody in traffic and it will not turn into an altercation. It got me thinking. I mean, I think that was the point where I grew up, because it's not just about, except for the fact that if you look up, I mean, if you looked up Udupi district on Google, it more or less says the only, no disrespect to Mahe or Robosoft. So keeping two organizations aside, it more or less says the only employment opportunity is mostly from fisheries or agriculture, right? So except for employment, everything else is so perfect. Maybe employment and the fact that if we all learned how to drive well and follow traffic rules, it would be the absolutely best place to live in. So that got me thinking how I never want to leave from here. I want to make a living here and hopefully create jobs and be a part of this ecosystem where I can ensure that the smartest people who are around here don't leave this place just for the sake of looking for better opportunities. I mean, as you grow up, you want healthcare, you want education for your kids. Everything is the finest in the country. So why leave from here, right? And that's when my co-founder and I, towards the end of our college, we decided that we want to take up entrepreneurship. And entrepreneurship just meant we want to start our own business in any sense. We didn't have this idea of building a product or commercializing something like that. We just wanted to set something up, and he was the right person for me. I had known him for about 20 years, so it was a no-brainer for me to ask him to join me to start a business. My parents were fundamentally very upset about this. For about 2 years, my dad refused to speak to me, and he was overly upset about the fact that ಅವನಿಗೂ ಹಾಳು ಮಾಡ್ತಿದ್ದಿ. So for my co-founder, who my family is known for a long time now, and I think that journey that I mentioned, which took me about 9 days to come from Delhi, this was in 2012, 2013. So WhatsApp was very nascent. My parents were not able to contact me, so that probably primed them a little bit to understand that he's not going to listen to what we're trying to say. He's just going to do his thing. So let him do it and learn it his own way, right? So it kind of aided with that. So my co-founder was also a mechanical engineer, so we were very good at building things, just making things, hardware things out of our hands and selling it. So the first thing that came to our mind was we saw a lot of tech-inspired furniture. So in Perampalli there is a small area which is the equivalent of Shivajinagar of Bangalore, where there's a huge scrapyard. All of the older engine blocks and all of the automobile equipment just gets dumped there, and it's about 10-15 years old, so it's fully corroded. And so my co-founder and I, we just like brushed through the entire thing. We bought 2 engine blocks, we took it back home, we asked a neighboring PVC manufacturing factory if they could give us a water tank, the 1,000-liter tanks you get. So we cut that off, we put the engine block in it, we put salt and water, and we connected it to a battery, got rid of the corrosion, powder coated it, made equipment out of it, and we started selling that. This was very surprising. This was the first time that we had any source of money coming in. So we were very fascinated by this, and we decided on this is nice. This was in 2015. This is very nice that like we were able to leverage our skills and our love for building things and make a living out of it. It wasn't great money, but it was some money, and it kept us going. So, and then we kind of switched over to industrial automation as well. We started building automation equipment, like mechanical automation, not IoT based, for gates, for factories, for any manufacturing units that required their gates and doors to shutters to move. By about 2017, we realized that this is not working out. I mean, this is not a very scalable business. This is nice, it's fun, but at some point we have to grow up and build something that is more sustainable. And that's when we realized that, we have this expertise of making products. Why are we building solutions and providing it to somebody? Let's build something that we're able to manufacture. We're able to build a manufacturing facility out of it, create jobs, and serve it to 4 corners of India. And then we realized that this is so very difficult in here as opposed to Bangalore, Mumbai, or any other place because of the lack of ecosystem in here. It's and I think from that standpoint, Mahe and Robosoft have been such an inspiration for us because to create something where nothing else exists is very very difficult. And to give you an example, about 3 days ago, somebody came to our office. He works on coconut. The they milk coconut and they make oil out of it. And he told me that he wants to work on building a platform for MSMEs and he wants to scale it into a startup company. And he said, I want to write a proposal to Startup India. Can you help me with that? I'm like, sure, yeah, this is something that we're quite good at right now. We've raised a lot of non-dilutive capital, so I would love to help you with that. And he said, okay, but I don't want you to do it for free. It doesn't matter what you do. Like, even if it's like a few hours you're putting in, I definitely want you to charge me for it. And I said, I don't want to take your money, not because I see the value in what you're saying. Charging is good because then I would take it more seriously. But then the thing about entrepreneurship is that we are so dependent on everybody else around us. That ecosystem is so important that no other job is that way. If you're a doctor or a policeman, there's always a fixed number of slots you're able to fill in, right? Everybody else is a competitor. Everybody, the more there are, the worse it is for you. Except for entrepreneurship and business, because the more there are, the better the ecosystem looks, the more you will thrive. Just for that, I mean, to give you a context of this, if I have to hire somebody from Bangalore, I think the biggest challenge or something that first comes to somebody's mind is that, okay, this is a good company, I like the work, I'm okay with the pay, I will join. What happens if this does not work out? Right? What happens if the company fires me, or if this just doesn't happen to be a good fit? What do I do next? I can't go back to Bangalore. In Bangalore, if you're in a company, you get fired on the fourth floor, somebody on the third floor will hire you. Right? This is not the case in our region, and that's especially why this ecosystem is that important. And I'm truly grateful to Mr. Rohit Bhatt that through TiE and all other initiatives that you're trying to bring all of the people together, trying to create this ecosystem where we're able to depend on each other and build something that is holistically much larger. So I'm sorry, I'm going to slightly deviate every now and then, but at the end of it, I will try to make a unified point from my story. So back to 2017, we realized that the ecosystem is very important, and that's when we went back to our alma mater. We joined the incubator again because I realized that Manipal Group is probably the finest organization in that space. So at least, if not anything else, I will get to learn from them on how they built that. Where it was just a barren rock, Manipal was just a rock 50 years ago, and now there is a city that has been built by one enterprise and one gentleman. So we went back, and by about 2017, we realized that we had to start working on product based or anything that is more tech focused. I think our first break came in when we met a veterinary researcher from Shimoga who had developed a mosquito larvicide. He had developed a very eco-friendly larvicide. A larvicide is a liquid that you can just put in water and it kills all the larvae, the mosquito larvae. What the challenge was the delivery system for it. It had to be immersed in a way that it kind of takes over the entirety of the stagnant water, and it happens periodically, because once you do it, the mosquito, if you do it today, next day the mosquitoes will come back again. My team and I, we were able to build a sustained delivery for this larvicide. So what we did was a donut, uh, a circular donut has the perfect buoyancy to float and disintegrate. So what we did was we went to and we wanted something that floats. So we went to a poultry farm and we got chicken feather dust. And chicken feather dust are usually, it's a highly unmitigated industry waste. You can't do anything with poultry waste. And we realized that this solves two problems, where one, the waste is taken care of, and other way, it can probably provide a sustained release for the larvicide. So what we did was we started grinding the chicken feather dust. We made donuts out of them, and we impregnated the donuts with the larvicide, so that this as a product right now, you can give it to slums, where in the slums you have tarpaulins for the roof, right? So, and that usually collects water, and that's a breeding ground for mosquitoes. This cake, you can just toss it in the water. So that over a course of 15 to 21 days, it slowly releases that larvicide and mosquitoes don't accumulate. So this product got us the national attention that we required at that point, so that we had that traction that these boys can do some kind of work where there is some form of societal impact there. This was later taken on by a university-led enterprise, and they are commercializing it right now. And then we realized that, so this was a partnered project with another university. We realized that we had to build something on our own, something from scratch. And our product and journey started with one conversation over a cup of tea with my advisor, my close mentor, Dr. Arun Chanbag, who was then the Chief Innovation Officer at MAE. Now he's the Dean at Manipal University, Jaipur. So we were just catching tea one day evening. This was during the month of March. Anybody knows what's the significance of month of March in public health? Everybody says COVID. Before COVID, so March is known for the Pulse Polio campaign. March is when the Anganwadi workers go with the oral polio drops for vaccinating infants. So this was during that time where he told me that, like, Mayur, today morning an Anganwadi worker came home to vaccinate my daughter. She's 4. So this Asha worker, she got the vaccines in a chai thermos flask with ice cubes in them, and the polio drops were inside the thermos flask. And when she opened the thermos flask, the ice cubes had all melted. There was just water seeping out of it. So she takes it out, and the water starts seeping out. He's like, "No, please don't put that in my daughter's body. Like, this does not look okay." And that's a huge challenge because one, vaccines require very strict temperature control. Secondly, the way that it looks, if it's that disgusting, that is just going to promote another huge problem, which is vaccine hesitancy across the world. Since COVID has been much worse, but vaccine hesitancy is a huge problem that we're still not able to mitigate so many vaccine preventable diseases. So he told me, Mayur, you guys are product developers, build something so that, like, you can replace this thermos flask and these rudimentary forms of cold chain for vaccines. And then I thought to myself, this is healthcare. This is not nice. I didn't even like biology in school. So this is not the road that I want to go through. Funnily enough, the very next day, there was a lady from Government of India who had come to the university to speak about some of the government-led grant in aid programs for translational research, for developing any fundamental research into a commercial product. I happened to just be there. I mean, I met somebody in there and just sat through it, and I saw about a grant in aid for about 50 lakhs, which said that if you have an idea for developing a proof of concept for something that is biotech-led, then the Government of India might consider funding it. We had, and my co-founder and I, we spent about 2 days thinking about how could we solve this, what my mentor said, and what the challenges on the ground, and what product could be used to plug this. So the idea that we came up with was that we looked at a traditional refrigerator, the way that a fridge works. And just to go a little backwards to talk about how this came in as well, a little bit of serendipity there. Between the college and while we built our company, I was teaching thermodynamics for engineering students. So I was very good at thermodynamics and I liked the subject. So I ended up teaching for any students who were struggling to pass. So I had firm knowledge of heat generally. So then it made much more sense to me. Then it's not just a healthcare problem. This is a logistical problem, right? The scientists make the vaccines. The vaccines work. They've done this, especially with COVID. They've done it in a record turnaround time where in 12 months, they've not skipped any of the steps. They've gone through the entire process. They made a vaccine that works. The doctors are helping provide it. The ASHA workers are carrying it. Everybody is doing their job except from a logistical standpoint. We as engineers, we have failed in providing the perfect refrigeration and logistical system to ensure that effective vaccines get delivered. So we looked at a refrigerator. We saw the problems with the fridge we have at home right now, right? Like when you open the fridge we have at home, the water bottles are in the door, the vegetables are in the bottom, and there is milk usually in the top, right? That's usually the compartmentalization in a refrigerator. It's usually because the door is slightly warmer, the milk part is slightly colder. So there's always a gradient. Fridge is never uniform. Is always about 5 to 6 degrees gradient between the different regions. Then we realize that this is a problem. If you build something similar and make it small, that is not going to work for vaccines because vaccines are freeze sensitive. The challenge is not just that vaccines require that they have to be strictly maintained between 2 and 8 degrees Celsius, but it's also if it goes below 0 degrees Celsius, if it freezes, they get rendered ineffective. That means you must have heard of somebody who's got both the shots of COVID and you end up getting COVID anyway, right? That's called a breakthrough infection where the vaccine has not created the right immunogenicity in you, and that's typically because we are not maintaining it in appropriate conditions. So we realize that this traditional system is not going to work. That's when we decide on building a model where it has to be portable and it has to have a dispatch mechanism where you can store about 15 to 20 vials. 15 to 20 vials, they're usually 20 dose. So that means about 200 to 400 people can be vaccinated in a particular day. And each ASHA worker, they traditionally do about 200 to 400 kids in a particular day. So we have to keep 20 vials in a way that there is a refrigeration system. All of them are being kept cold at that 2 to 8 degrees. And every time you want to retrieve one vaccine, you don't want to disturb the rest of the vaccines. If I want to take water bottle from the fridge, I don't want to disturb the vegetables. Every time you open the door, ambient air is going in and there is temperature excursion, right? That's what we wanted to prevent. So what we designed was a unique dispatch mechanism that will isolate every vial. What you want to take out, it can be brought to that dispensing point so that you can take that out and the rest of the vials don't get disturbed. Another issue is that biologicals have another problem of freeze-thaw cycles. So what this means is biological vaccines are attenuated viruses are just like you and I. We're living creatures, right? We don't like this thermal shock. Like we like this 17 18 degrees temperature, right? But we're okay with like 40 45 degrees also. I mean, it's uncomfortable, but we will live. What happens if it's 1845? Suddenly that shock is what ends up killing people. So, and the same principle applies for vaccines as well, that freeze-thaw cycles are what need to be minimized. And this is what we could develop. And we wrote it. At this point, this was completely theoretical and on paper. So we wrote to Government of India saying that this was under DBT of Ministry of Science and Tech. We told them that we can design the system. This will help you solve the larger public health challenge of delivering vaccines to rural and remote communities, because that's when typically vaccines go to waste. They were benevolent enough to provide us this granting aid, and this was a project for about 18 months. We were able to finish the project in 12 months of time, and we had about 10% of the budget remaining at the end of it. So we were able to take it to the next step. Beyond what we had committed, we were able to take it to the field and validate it. And Government of India the BIRAC committee was very, very impressed, because typically the granting aids for translational research is usually for scientists or academia. It's usually for professors who want to take their research into a commercial entity. It's not usually for 20-something engineers with no work experience, right? That's a huge risk. They're very happy with the progress that we made, and at that point the question came up on what is next to this. Follow-on funding is very difficult, especially in two worst spaces that you could possibly be in. One, we are a product-based company that is going to go into manufacturing. That is not very venture capital friendly. Secondly, this is public health, which means a lot of your customers are going to be government agencies who are very slow, very painful to work with, and the receivables never come in time. Right? These are major red flags for any private investment. So the committee asked. I mean, while I was there, the committee asked the rest of the. Government agencies usually have private partners who implement the fund. They give the money to a private agency and then they monitor the progress. Our monitoring was done by National Chemical Laboratories in Pune. So they were our fund partner. So they said that, you know what, we're very happy with what these guys are doing. We would want to give them an equity investment of about 30 lakhs so that we can see that if they can build a industrial design out of this. This is a prototype. This works now. What's next, right? So this first investment is what kind of changed the entire game for us, because by 2019 we had an industrial design. We had one product which looks good, it works well, and we could deploy it in the ground. And we had completely validated internally in the lab and validated outside. What we needed was a paying customer at that point. And it's God's gift to us that Selco Foundation somehow found us at the right moment, and they came to us and they said that we've heard about this portable vaccine carrier that you're developing. Could we please buy 2 units from you, because we are in dire need of it? And we jumped at it. We wanted to know, what is this application? Why do you need this? You're a private organization. Why do you need this? They bought 2 units from us and we just followed them. We just went where the product went. And this is a very interesting story because it went to a facility called Swami Vivekananda Youth Memorial Hospital in a place called Sargur. This is a very remote health facility in the outskirts of Mysore. So the Mysore has the Nagarhole Forest Reserve, and in the outskirts there's a very small health facility run by about 6 doctors, cutting edge scientists back in the day, who are now they want to give back to community, and they live in this cut off facility, and they do immunization for the tribal community. So there are Jainu Kuruba tribes living in the Nagarhole Reserve. So these guys, they take ice boxes with vaccines in them. They take it in a mobile health unit. It's like a tempo traveler with DC power in it. They take the vaccine. It takes about 3 hours for them to reach the settlement, and then vaccinate and bring over the leftovers. They started using our product, and now 4 years later, they are telling us that every month, earlier they were vaccinating about 20-25 kids in a particular day. Now they vaccinate 55-60 children every single day because of longer cold life. They're able to save about 13,000 rupees worth of vaccines every month, because all of the vaccines they take, it doesn't get utilized at the end of it. Most of them get discarded because if it's left over, you just end up throwing. The ice packs end up melting, and it gets thrown away. With our system, they're able to safely bring it back, plug it in, refrigerate it, and reuse it again. This got us the big break. I could talk about this in multiple avenues, the kind of social impact we're building, and this led us to raise follow-on funding. We raised our second round of investment from C-Camp and Social Alpha. Social Alpha is a brand under Tata Trust. We were able to build a small batch production facility inside the incubator itself. We took a space which was about 1,000 square feet, and most of us were engineers itself, so we all kind of came back and we started assembling it ourselves. And about 15 units we could assemble by ourselves, and deploy it across the country for veterinary vaccines in Jharkhand, for breast milk application. A truck driver in Rajasthan bought from us because he wanted to carry his insulin. Insulin also requires the same temperature control, and he was very upset that every time he has to go on a long distance trip, his insulin goes bad. So he bought it from us so that he can carry that. So we found multiple applications for this, and that's when we realized that this is something that is scalable, and we could probably reach out to WHO and get a pre-qualification done for the product so that it can be scaled globally. This is when we reached out to the Manipal group. We knew that we're in Manipal. I think the next stage of growth for us is to get into manufacturing of the system, and the right people to talk to about setting up a manufacturing facility in Manipal is probably the Manipal group. We reached out to Dr. Anjan Pai, and I think they had the same reservation of this is a lot of money you're asking. It's not very return friendly. It's not a good space. We love the social impact. We love the kind of societal challenge that you're kind of overcoming with this. The healthcare impact, which is also something of a focus for them. But from a financial return standpoint, this is not very nice. And I had to build a whole holistic case on how I studied in your college. I have seen an injection molding equipment in my laboratory where nobody knows what it does or what it's supposed to do, right? Please help us set this manufacturing facility up where we will be molding, we will be making plastic parts. And this way, students get to really see the end-to-end journey of how your education is translating into real-world practice. And that's something they empathized with, and they immediately jumped into an investment. And we were able to build and they were benevolent enough to even actually give us a facility. There was an old warehouse, a storage facility that the Manipal group were using for all of their documents. They were able to give it to us. We fully refurbished it, made it compliant with ISO 13485 standards for design and manufacture of medical devices. And we set up the facility, and this was about the time for delivery of COVID-19 vaccines itself. And the relevance for COVID-19 made it more sharper because the two vaccine candidates in India, Covaxin and Covishield, both of them were freeze sensitive, and India has data that over 65% of all the vaccines we administered are subjected to suboptimal temperature at some point. In some point of the supply chain, they are exposed to freezing temperature, which means there is a grave risk that we're administering vaccines that have lost the potency. And across Northeast India, we've done enough validation studies now to realize that there's 8-9 hours of freezing, and we still end up administering these vaccines to kids. This is a huge burden. We are now live in 12 states of India. We've helped administer over 150,000 doses of effective vaccines in some of the most rural and remote locations of India. We're very proud that this is a product that is completely conceptualized, designed, tested, iterated, prototyped, manufactured, calibrated, certified, and delivered from Manipal, and it's serving 4 corners of India right now. Thank you. This and we knew that it can't stop at just India and the neighboring regions. We knew that the problem is something that is relevant to all of the global South. So Africa has been the focus for us right now. Just to give you a context of the magnitude of the problem, 2021 was the worst year in maternal and child immunization. 23 million children missed out on first vaccine, and this is because of the COVID-19 pandemic. So we've backslided on about 11 years of immunization effort, and that's why the global focus has gone towards immunization right now. The next 10 years, WHO is claiming that with the pandemic treaty, all nations have to come together for strengthening the primary health system. And this is the space that we really want to step down on right now. I think you must have heard about the measles outbreak in India last year, right? It was a terrible outbreak across India where about 250 casualties, but 12,000 kids contracted measles in India last year. Measles is such an easily preventable disease, and it's still happening across the country, and it's an easily vaccine preventable disease. Vaccines are available. Vaccines have been validated for over decades right now. We are not able to effectively get it to the people who need it, and that's been our challenge, to ensure that every mother and child across the globe receive effective vaccines on time. That's been our focus, and that's something that we want to carry on. I want to thank each and every one of you for listening to my story. Thank you to TiE. Thank you everyone for having me here today. Thank you.
Congratulations. So how much time did it take for you to come to this stage, like from the inception?
It took us about 4.5 years of R&D. Typically medical devices, that's the problem. I mean, the gestation period is quite long. I think the standard time for a medical device is about 6.5 years, including the design development, the clinical trials, and the compliance. Fortunately for us, we didn't require clinical trials. So one stage of it we could skip. The compliance, unfortunately, is extremely high. It's very strange to say this, but India has almost no compliance for transport of organs. We're now transporting organs across northern India. Corneal tissues, for example, India loses close to 50% of all donated eyes. They are not viable for transplant. That is terrible. It's because of delay and infection. And in cities like Mumbai, it's 75%. If you tell a donor that like there is a 75% chance that the donated eyes are going to be thrown away, think about the motivation that is going to go into the eye donation, right? And this is a huge problem for. I'm sorry, I'm kind of deviating from the question you asked. But yeah, so there is no compliance or regulatory issue as such. So we're able to deploy it for alternate application. But for vaccine delivery, vaccines are taken very seriously by WHO. So government agencies don't work without that. That is what has taken us majority of the work. Because we could skip on the clinical trials, I think we could finish it in about 4.5 years.
Thank you.
Wonderful story, Mayur. Can I share some insights, from your experience of applying for government grants, and how did it go?
Yes, sir. So I think there's a lot of every time, specifically with Karnataka, and I don't want to pinpoint at any specific administration. It doesn't matter if it's a Congress now or the BJP earlier. I think the general perception that most people have is that, granting aid, you have to have some form of like connections or some underhanded thing that goes into it. I think I can't speak much for the government of Karnataka because we've not worked much with them. But with the government of India, I am very proud that we've not had to even indicate about paying a single rupee to anybody and everything has been so clean. We've gotten about 7 grants. We've raised about close to 6.5 crores of non-dilutive capital. We've not paid a single rupee to any government agency. It's very clean. It's very effective. And I think the government is doing a fantastic job at finding the right people for the panel also. The committee is always very good. They ask the right questions. They get people from all domain. I mean, back in the day, it was always very senior scientists from academia who will press you on only the science-related questions. But now the panel is quite broad. So I think if the holistic case is done well, from the commercialization, the business, the unit economics, and the technology, if everything is covered, I think it's the most appropriate time. Even like Mr. Kalbavi suggested, I think now is the best time for anybody to start a company. And I think for a science-led enterprise, I think no better time than now.